Do not disturb. Hello, gentle people. Welcome to another Sunday Share Live here on IG with me, Havali. And yeah, guys, today is World Pharmacist Day. So I want to take this opportunity to say Happy Pharmacist Day to all my amazing, wonderful, awesome, phenomenal, brilliant, the exceptional pharmacists who are on the front lines doing the darn thing. You're awesome, you're amazing, you're wonderful, you're appreciated, and I'm sure that your patients have nothing but crazy love for you all. So, for those of you who've never met me before, my name is Havali, and I live here in Canada. And I am a pharmacist by profession, but I also have a business that teaches pharmacists how to self-sponsor and move to Canada and transfer their licenses. So feel free to join this party over here. Hi, my dear Martina. I'm telling you guys, Martina is, I said Martina, Martina, Martina. I'm so sorry for butchering your name, but Martina is the real VIP. And my nephew's joined the line. Welcome, nephew. Yes, so guys, today I'm going to be talking about several things. I don't have a set agenda, but I wanted to greet all my wonderful, amazing pharmacists. I know a lot of the persons who come on this live weekly, they're pharmacists. And I want you to know that I appreciate your support. I try my best, my endeavor best to answer all your questions. I see your comments. I respond as best as I can, as I humanly can, because this is a solo ship over here. So thank you all so much. And yeah, as you guys can see, and you can tell that I'm wearing warmer outfits because the season is changing. No, it's not freezing, but the temperature has fallen significantly. Like today, it's lower double digits. I think it's probably around 12, 13 degrees. And then it's raining, so that, it's a little chill. But I haven't been outside in like 2, 3 days, so I know I need to get my vitamin D, but I don't see any sun outside there. So I just took out my vitamin D supplement and I'm going to get back on that train. So today I have some exciting news to share with you. So recently, and when I say recently, I mean very recently, the Canadian federal government has made an announcement to open up or provide an exemption, sorry, for a healthcare professional in Canada so that they can get through quickly for the express entry system. No. Does someone want to guess which healthcare provider is getting an exemption right now? Hi, Toya. Who wants to make a guess? Who wants to make a guess which healthcare provider is getting an exemption for express entry? This is exciting news because it means that things are rapidly changing. I'm telling you guys, you have to stay ready. If you want to move to Canada, you just need to be ready. You have to stay ready. So when the opportunity comes, you jump on it just like that. Nobody wants to make a wild guess. Nobody wants to make a wild guess. If y'all don't make a guess, I'm going to spill the beans. Yahoo. Correct. It is doctors. So the government has made an exemption for doctors. So I didn't realize this. I know that similar to pharmacists and nurses, that doctors could apply for express entry to Canada by submitting their necessary documents, as we've discussed in previous lives. They could do that and they could get selected, because as doctors, they are regulated healthcare professionals and they need an entry to practice license. Similarly, pharmacists requires the same thing. People who are veterinarians, so veterinary medicine, people who are podiatrists, chiropractors, and I can't remember exactly who the other one or two person might be. But those persons who have licenses that they need to practice within their professions, it's like whenever you're being assessed for express entry, you get the same amounts of points as someone who has a master's degree. So even though it's an undergraduate bachelor's degree, you get more points. And that is significant, especially for your selection process, because that gives you a competitive advantage. So in Canada, there are several doctors who are here, but they're not able to register because they are self-employed or they were self-employed, and they could come across under different programs as well, but they're legally in Canada. If they're working for, like they call it, pay for service, if you're a self-employed doctor, I didn't realize that you couldn't self-sponsor under express entry, which is a really interesting thing to me. But no, the federal government is making an exemption so that these healthcare providers will be able to get their express entry selection real quickly. And sorry, I'm a little distracted because I pulled up my computer to find the documents so that I can give you further details. I didn't realize that they couldn't apply for express entry because they are self-employed. So they have made an exemption because right now, healthcare is in a crisis. And that's a fact. It's not just in Canada. It is something that's happening worldwide. And it's not just with doctors and nurses and pharmacists, but we know that the health sector is one of the most important sectors. Yes, everything boils down to a business. Every sector is a business. But if we don't have health, what do we have? If we don't have health, what do we have? And if we don't have the people who can provide these services, then things are going to get really, really bad because people need to be taken care of. When you're in good health, then you can be of value to your community, to your family, to your country, and on a global scale too. So they need healthcare providers. Even throughout the pandemic, I can recall there were 3 places that remained open right throughout the pandemic: the hospital, the pharmacy, and the supermarket. Because in addition to being healthy, people also need to eat, right? So these care providers are needed in Canada. So the government's doing everything within its power to get these people registered. I made a post, I think it was earlier this past week, about the amount of professionals who moved to Canada and are doing menial jobs, collecting meager salaries, and they're not able to get regulated within their profession so that they can work, contribute, and earn enough to take care of themselves and their families. So there are doctors here driving the Ubers. There are doctors doing the call center work. There are doctors, I'm not sure if they're in the McDonald's and the Burger King and the Wendy's and the Dairy Queens flipping the burgers, but whatever gets food on your table and keep clothes on your back and keep you going until you sort out your stuff, you figure out your stuff. I've had so many people, not doctors in particular. Well, I've had a doctor or two contact me about wanting to move to Canada. So this is great news for those doctors. Even though I think they probably are practicing in the public sector in their countries right now, so they would be able to apply for express entry regardless. But there are persons who have been reaching out to me saying, hey, I moved to Canada and I haven't started the process of getting registered yet. And I know that it's very challenging for a lot of people to get registered in their professions, get regulated, get that license so that they can start practicing. Because guys, listen, don't take everything that you hear as gospel. Do not take everything as gospel. Take it with a grain of salt. And take it also from somebody who's lived through the experience. And I know experiences are subjective and everybody has a different experience, but it's better for you to take that from somebody's first-hand experience rather than believing everything you hear and seeing all the filters and the glamorous things and the shiny objects. Life in Canada can be tough if you're not in a secure financial position, because that's a fact. You need to be working a certain amount of money so that you can live a decent life, because honestly, cost of living is high. But even for the average person coming here, even if they were living in their own home and they wanted to mortgage a house here, for example, those persons need to have like almost 35% deposit down on a house. Now, if a house is $100,000, we're talking about 35K. You're really not gonna get a house here for 100K. You're looking in the you're looking in the range of, maybe depending on which province you're living in as well, you're looking at like 350K, 500K. We're seeing houses in Canada, in Ontario, sorry, for $1 million, 800,000, 1.5 million. So most people, when they initially arrive, they will have to rent. And if you're living in Toronto proper, you're looking at 2K per month. If you're living in the GTA, you could be looking at 1,500, depending on where you are. And the further out you go, away from the Toronto proper, you will be paying less. But the fact is that rent ain't cheap. So when you move to Canada, it would really help if you got regulated as soon as possible. So I know I was talking about doctors now being able, if they're self-employed, and if they're, especially if they've had some of their education in Canada, they can apply under the CEC, which is the Canadian Experience Class. If they've had education and like a postgraduate work permit, or if they have been practicing here as part of their studies. I had an assistant at the pharmacy at one point in time, and he is now in medicine. Really awesome guy. Big up yourself, Luke, wherever you are. And I know that a part of his training is going to be in the UK. And I also had a colleague at the pharmacy, a pharmacist now, and he had his training in the UK, and then he came back to Canada. But the fact is that he's a Canadian resident or citizen. I think he's a citizen. So that didn't really matter. But for those people who come to Canada and they did a part of their studies here, eventually there are processes in place to apply for residency. But I did not recognize, or I did not realize rather, that doctors who are self-employed were not able to sponsor themselves under the express entry system. So with the federal government taking that initiative, I think it is a wonderful thing. And the thing I'm thinking also is that pharmacists might be next, or nurses. I know that they're making it easier for doctors to get registered, especially in certain provinces where there's a shortage. I know for a fact that in British Columbia, they are short on doctors, because there was a patient who put an ad out in the paper willing to pay any amounts of money for their, I think it was her spouse, to see a doctor because they didn't have a doctor. And I know that in Nova Scotia, they want doctors to get these exemptions so that they can get registered and so that they can make a contribution to the society. We are also having a shortage of pharmacists, and we have a deficit of nurses. So the government, starting with doctors, I think it's a possibility that this could be extended to nurses and or pharmacists in quick succession. And they're making plans already to change how the express entry system works in terms of these medical professionals. Well, they didn't particularly say medical personnel. They said based on a labor, like the need for your labor. They did say based on an economic need. That's the term that the minister used. So basically, if there's a shortage of nurses, if there's a shortage of doctors, and there's a shortage of pharmacists, what do you think? Don't you think that they're going to extend this to other healthcare providers? I absolutely think that is going to be the case. So I'm going to pull up this document here and just read a little excerpt for you to tell you exactly what the minister has stated. Why am I opening the wrong thing? Do you guys have any questions for me in the interim? I know you're soaking up all the information that I'm giving, but I'd like this to be a more interactive session. So if you would be so kind, if you don't have any questions, a comment will do. Paulette, I did see your messages. It just popped up at the top of the screen. As soon as I'm able to, I will attend to those and I will be in touch with you. And thank you so much. I have been getting your emails just in case. I meant to send you an email a couple days ago, but you know, with the multitasking things get slipped up. So I did in fact receive your email and I'm going to respond to you as soon as I possibly can. Guys, here's an interesting fact. Did you know that if you had already passed your pharmacy board exams and you're in the phase where you're awaiting your license, that you can get an emergency license to practice as a pharmacist in Ontario province? It's a possibility. And the fact is that if you're practicing as an emergency in an emergency capacity, you will still be paid as a pharmacist, but there are certain caveats to that. So I believe that you have to have the name of the address of the establishment where you'll be practicing. That has to be sent to the college. In addition, thank you, hon. In addition to the address being sent, you also have to practice. You're not practicing the capacity of an intern. You're practicing as a pharmacist, but as an emergency pharmacist. So there has to be a licensed pharmacist at the establishment, and you also cannot operate in the capacity of a pharmacy manager while you're doing that. But you can do it, and the best part about it is that it is free. You do not pay for the emergency license. I do believe right now it is supposed to be for about 60 days, but with the shortage of pharmacists and we're still in the whole COVID situation, a lot of people are letting their guards down and they think that we're out of the woods. We are not. So COVID is still alive. COVID is still very much around. So if you were a pharmacist and you had passed your PBC exams and you went through whatever other processes you need to go through, in each province it's very different. Like maybe for one of those upcoming lives, I will take you through the processes, for example, in Alberta, and how it has changed over the years, because since 2016 to 2022, so many changes have happened. So I'm excited about the newer changes, though, about the government making exemption for healthcare providers. So I said I was going to read from that particular document I had about doctors being exempted under express entry. I had it here. Heavily. What's wrong? Oh, I looked too far, guys. Yes. See right here. So basically it said that so a new TR to PR pathway for doctors in Canada. So TR basically means temporary residence, and PR is permanent residence. So the government, which is the minister, Sean Fraser, he's made an announcement that changes will be made to express entry to help doctors who are in Canada on a temporary visa to get permanent residence. And this will help the doctors working on a temporary basis, and physicians working as self-employed individuals will be benefited through the new change in the express entry system. I know I keep saying express entry is making different changes, but every week there's an update. There's something new, something exciting. So you have to just keep your head above, keep your ears open, and also get ready. Like, you have to prepare yourself. A lot of people think that yes, I want to move to Canada, but I don't know if they're really and truly serious about moving to Canada, because moving to Canada is not ABC. You have processes that you have to go through. I mean, for the person who is really serious, they could legit get everything done within a couple of months. Let's just say 4, 5, 6 months, depending on how swiftly they move. And if they're selected, then there and then they would have to have everything ready within 60 days, because you have to submit your profile, accurate profile, within 60 days. It used to be 90 days. And then in June 2019, it was June 2018. I remember because I think it was June 24th in 2018 that the government said after that express entry draw, the other cohorts would only get 60 days, because there were persons who were waiting for the entire 90 days and then they wouldn't submit all the documents, which really is a waste. Because if you get such an opportunity, if you need it or you said you wanted it, why would you waste it? So it's not as easy as, oh, I'm just going to grab my passport, grab my kid's passport, because you have to consider those factors as well. Oh, I'm going to grab my degree. No, you have to go through an entire assessment process. You have to send these documents to the right body. You have to get a lawyer to get your documents done if you're in Jamaica, because we don't have notary publics in Jamaica. But if you're in the US, they have notaries. If you're in Canada, they have notaries, and some other countries. You need to think about all the stuff that you need to get together. It's a whole process. It's not just, oh, I'm going to get this, and tomorrow I'm going to get that. The minute you think, you start putting in your head that this thing is going to take a minute or two, and you start actually going through the process, you'll realize that you need an hour. So it's best if you get yourself ready and try not to procrastinate too much. That's one of the things. When I was going through the process, I didn't procrastinate on anything, because I was so driven and I was invested. I was emotionally invested. I was financially invested. All the different kind of investments that you can think about. Like, that was a main goal for me. That was a major focus. I find that when I have other things to do and I leave, it's like, oh, I'm going to get this done tomorrow. For example, I had to get a document notarized recently, and I had it in my head that I was just going to go to the pharmacy and there's a lawyer next door, and I'm going to get the lawyer to notarize the document. When I went to the place, the lawyer was out of the city. He was in a different city, and he would not have been back for another week. And I'd call another law firm, and they said they had no availability until the next week. And I'm like, oh my gosh, if I had been as invested, because it wasn't life or death, it was urgent, but not that urgent, because this was on my own volition. I was doing this off my own, this thing that I was doing here. But if it had been express entry and I was going through the process, I would have gotten that appointment long time ago. So sometimes the way we plan things is not the way they unfold. So it's important for us to leave that white space. Give yourself room for example, if you make an error and you need time to have it corrected, you need to make some space for that. So I know I'm talking my head off. I was telling you about this whole physician thing. So it says basically, so I think it does apply to not pharmacists. I'm talking about pharmacists. It does apply to doctors who are working in Canada on a temporary basis. So that's why I didn't realize that doctors who are working here temporarily, they are considered self-employed physicians and they are not eligible for express entry. But if you're a doctor and you're working in your home country and you are working, whether it is in a clinic or you're working in a hospital, or I do believe if you work for yourself in your home country, then you have to go through the whole process of getting, like your documents notarized, or get some lawyer to sign something to say that you're self-employed and get all your your I said tax, your tax documents. So that would be different. But doctors who are practicing in Canada currently on a temporary basis, they're not eligible for express entry. But the government has made changes, and so they are now eligible for the TR to PR. So I think this is an extension of the TR, which is temporary residence, to PR, permanent residence pathway, that they piloted last year. That program was closed in December. And I know persons who had submitted their documents from last year, November, and they did not get a response from the government up until May, June, because of the backlog. But it is really tricky, because there are persons who could have applied for express entry, but they don't know what they don't know. So they come to Canada as either students or on a temporary resident visa or a spousal visa, and then they get into this whole jam of going through this pathway and that pathway. Honestly, I thank God, I bless God that I didn't have to go through all of that. I just stayed right home in Jamaica and applied, submitted all my documentations, and I got my permanent residence right there in Runaway Bay, St. Anne, Jamaica. A lot of persons have also asked me about how I got work permit. I didn't get a work permit. I got permanent residence, and that entitles me to live and work anywhere I choose to. So I'm so happy for these doctors, and I think that pharmacists are next. But pharmacists don't necessarily have the privilege of working here temporarily. I know a pharmacist who came here as a student and then got a work permit and then permanent residence. But that's a costly process, because if you're not permanent and you're temporary, you don't get access to the same amenities, you don't get access to healthcare, you have to pay for everything. And coming here as a student is really an expensive route, but that's the route that some people choose. To each his own, I guess. But some people just choose that because they don't know that there's a better alternative that's available to them. So guys, that is what I had to share today. And for those who joined at a later time, I also sent greetings to all my wonderful and amazing pharmacist colleagues and friends, because today is World Pharmacist Day. But that's not what this live was about. It was about the changes that are coming for the express entry system, and the fact that the federal government of Canada recently made an announcement that doctors who are here temporarily can now apply for their permanent residence, even though they're self-employed and they previously were not eligible. So I'm excited for those changes, and I'm looking forward to that being extended to other, not just healthcare providers, but of course I'm a pharmacist, so I'm gonna be a little biased. I said it, I'm not gonna let somebody say, I have a Lear always talking about pharmacists and you're biased towards pharmacists. I'm a pharmacist, so I can talk about what I know confidently. So I'm hoping and praying, because most of the people, honestly, most of the people who have reached out to me in terms of wanting to learn how I moved to Canada, they're pharmacists. I've spoken to people who are not pharmacists, but most of the people I've talked to all over the world, people from Dubai, Nigeria, Togo, Zambia, people from UK. I've spoken to somebody from Venezuela. Was it Venezuela or one of those South American countries where they're interested in pharmacy? I've spoken to people from Egypt and Pakistan. So all of these people that I've spoken to, most of them, at least 90% of the people I've spoken to, are pharmacists, and they're interested in coming to Canada. So I'm hoping and praying on their behalf that this exemption that's been given to doctors will also be extended to them, and also to nurses. And I know that there are a lot of barriers and a lot of challenges in terms of getting licensed in these professions, and they are removing some of the barriers for doctors, for example. Not that they're lowering the standards, but I think Canada has these really high standards. But after you cross the hurdle, I'm not saying anything bad about this country. I love this country, but really, I think a lot of the things that they implement, they're unnecessary and it is a money grab. I'm just gonna say it as it is because this girl does not know how to sugarcoat stuff. It is a money grab. And an example of a money grab is the fact that even though we're fluent English native speakers, we still have to do the IELTS exam. That's like 350 Canadian dollars for one test. Okay, you're born, you've been talking English since you were in the womb, and you're an English native speaker, and you had your education in English, all your education from kindergarten to university and upwards, and you still have to do the test. Okay, nobody gets exempted from IELTS. You have to pay for an ID number before you can start your application process. Now that to me is ridiculous because you don't need to pay for an ID number, and it's $340 plus tax for an ID number. And that came into effect in August 2014. And I know because in August 2014, that was around the time that I completed my pharmacy internship and was basically just eyeballing what this process was all about. I hadn't made up my mind completely that I was moving to Canada at the time, but I kind of was borderline saying, yeah, I'm interested. I'm gonna just, look at what's going on in that space. They just implemented that in 2014. And then, for instance, you could have passed your first exam in Canada. At the time, you had to come to Canada to do the exam. You had to pass your first exam, and then you could apply for an internship license. No, you have to pass the second exam and or the third before you can apply for the internship license. And then you also have to do this bridging program that's so expensive, $14,000, $15,000, $16,000. So again, I said it's a money grab, and I stand by it because they're always putting more and more things in place. I don't know if it is to deter people from coming here, but they need the people to come here. So I don't understand the logic. In any case, that's just my thought. And I thank you all so much for joining in and for your contributions. And yes, I will be responding to the persons who have sent me direct messages. And stay tuned. I will be posting more about the changes that are coming. Oh, guys, and before I go, one more important announcement. The last express entry draw that was done on September 14th, Wednesday, September 14th. I think that was the day. Yes. So they made an amendment to that minimum CRS cutoff score, which is a comprehensive ranking system score. It was 511 initially, and then they changed it to 510. So this week on Wednesday, we're coming up on another draw, and I will definitely keep you all posted. Okay, so thank you again for joining in. I appreciate you spending your evening with me, and I will talk to you all again pretty soon. I know I'm 2 hours early this week because I'm on a different time zone. And I tell you, whenever the time zones change, it's like, yeah, I was supposed to come on at 8, but it is okay. At least I got the information out there. So now you can assimilate it and you can pick whatever information that's applicable to you and disregard the rest. So until next week, Sunday, unless I have some major announcement to make in the week, then you'll see me on a live. If not, I'll catch you again next week. Thanks for joining in and have a good week. Bye.